Welcome everybody, and thank you for coming back to Dental Care Niagara. As you can see, I look a lot different, so I'm going to take this time and opportunity to walk you through how your next visit at Dental Care Niagara is going to look like. When you arrive, you're going to be instructed to sit in your car, and you're going to either call or text phone numbers that are written out on a door. When you're instructed, you're going to follow inside where the greeting person is going to receive you. We do advise that you do a few things, which is when you're driving to your appointment, do not wear your face mask, and please wash your hands at home. If at all possible, we do ask you that you arrive 10 minutes earlier for your appointment, as you're going to have to go through screening questions, and also that you use your washroom at your home. Once you're ready to arrive and to come inside, you're going to go through the doors as you always went through. And do know that all those doors and door handles have been disinfected prior to you entering. So please follow me. As I told you, you're going to walk in, and although I said that all of the door handles have been disinfected, I strongly urge you that you use your elbows in order to open up the doors. Once you're inside, you're going to walk up to the sanitizing station. You're going to use a 1 pound, and you're going to follow up the diagram that's going to be provided to you. You're going to thoroughly disinfect your hands for about a good 30 to 60 seconds. You're going to rub it all the way around, and you're going to wait for your greeter to take you into the screening area. We do ask you that you bring your own mask, and if you don't have one, one will be provided for you. Once you do enter into the screening area, the greeter will ask you a series of questions. All these questions are pertaining to the current COVID-19 situation, and they're going to ask you through the whole symptoms and screenings of all of your travel history and everything else. It is extremely important that you are sincere and honest in answering all of these questions. At this given point of a time, your temperature will be measured as well as will be saturation of your lungs as well. If you pass all of the screening questions and all of the vitals, you will be around and taken immediately into your treatment room. In case if you don't, you will be asked to actually reschedule your appointment. Your cooperation at this stage and these steps is extremely important. Please also note that we are also limited by number of people that we can see for any given time frame. We're no longer able to hop from room to rooms, as every single room after it's being used, it's supposed to be remain closed and disinfected thoroughly and cleansed and cleaned with a HEPA filtrations. But that given point of a time, we'll no longer be able to allow to accommodate larger families all at one given point of a time. So we recommend that a family member's appointments be broken down. We apologize for any inconvenience, but please know that we're going to work very hard to try to accommodate to the best that we possibly can. Welcome to your treatment room. As you can see, it looks almost the same as before, but there are a few changes that we're implementing in the rooms as well. You will be seated in the same chair, you will be covered with the same bed. We do ask you that you bring your own sunglasses. COVID-19 is known to transmit through the eyes as well. The sunglasses that we have that provide will disinfect them, but we believe it would be a much better idea if you bring your own spare set of sunglasses for your future dental appointments. We will ask you to rinse your mouth with antibacterial mouth rinse, which will reduce the load of any bacterial viruses inside your mouth for the procedure they're about to enter. Know that some of your common procedures may be altered due to new protocols and procedures in place in order to ensure minimizing aerosol generations. Most of these might pertain inside the hygiene side, which means that if you're used to having your teeth cleaned with a cavitrons that produce a lot of aerosols, in the next little while we might resume to a little bit safer hand scaling procedures. Do know that once we're inside in here and once we have all of our PPE, the doctor cannot leave the room until the procedure is finished and complete, which simply means sometimes if you're doing a hygiene side for a check, That check may not happen and may have to be added to your next hygiene appointment. We'll try our best to accommodate to make sure that that doesn't happen, but it is possible with all of the different follow times within the rooms that it may occur. I want to let you know that a lot of our structural changes went inside the building as well. We've upgraded our whole HVAC system. We added a UV sterilization throughout. We have purchased this big medical grade HEPA filtration units, and we also are going to fog the rooms in between the procedure. Therefore, there will be a significant follow time when the room is being emptied and we will not be able to use this room, which is extremely important that you do keep your appointment, as missed appointments will be very hard to accommodate in the future. We also want to let you know that on top of what I'm wearing right now, I'm still going to have my regular loops. I'm going to wear an N95 medical respirator. I'm going to wear the level 3 mask on top of it, and I'm going to have this face shield in order to protect us from further splatter. Know that the breathing through the respirator is extremely difficult. We love chatting with you and we love having a conversation. And under these particular masks, we will simply have to focus on our own personal breathing. So the conversation might be limited to the minimum during the procedures. Once the procedure is complete, we will update you on all of the things that we normally used to do in the past. Thank you. Well, the last I'm going to talk about how the whole booking system is going to work from now on. As you have heard in the letter that's coming down to your houses, we were forced to make a very tough decision, and that is to move away from any possible paper trail, handling the paper in the office. We're going to go to a completely paperless practice. We would like to communicate with you via your email address. 1 week prior to your appointment, you will get a phone call from one of my team members, and it is very important that we hear back from you. This is the phone call that is going to go through the same screening process. 24 hours before your appointment, you're going to receive the email from us, where it's just a reminder for your next day appointment, provided that none of the symptoms have popped up that pertain to the pre-screening questionnaire. If you do develop any symptoms, it is very important that you do contact us immediately and you share that with us. As I said, Ministry of Health do not want us to treat any patients that might have any symptoms listed on the list. To avoid aggravation during the day of your appointment, we simply ask you to communicate that to us prior to it so that we can make a proper arrangement. We also do ask that you provide a credit card. We will keep that credit card in a very safe spot in your file. When your procedures are being done, your credit card will be charged, your receipt will be emailed to you along with all of the procedural codes, and all of your insurance information will be filled out for you and mailed to your particular provider. From our patients that prefer to do these type of transactions with us previously and before, they told us that by setting up an online insurance forms, they will actually receive their money sometimes even the same day when their procedure has been done. They love the ability of using the credit cards and all of the earned points for their travels and their own leisures. We do hope that you will understand it is a big transition, but it's a much needed transition in order to keep everybody and all the parties involved safe and sound. We look forward to seeing you very soon. And please note, due to the increased follow time, limited amounts of patients that we can see in a day, we no longer may be able to accommodate your last minute changes in your personal plans. Such as, I got even my hairdresser to get my hair done. So I do apologize, we may not be able to accommodate such things anymore without having to reschedule you further down the road and upsetting you. So to keep all of this nice and safe, happy and sound for all of us, please try to work with us. I sincerely can't wait to see you and receive you, and my team and I are so excited to give you the best possible smiles very soon. Stay safe and we'll see you again.